This is Dr. O with Advanced Physical Therapy and Wellness, and we got the camera guy, Dr. Myro, our rock star PT, and we were just reviewing like some SI joint dysfunction stuff. So first and foremost, we'll be talking about sacral torsions. So essentially one of the things that you'll be doing is a march test or Gillet's test, they call it, where you have them stabilize against the wall or just something that they can grab onto, and then you have them lift the right knee up like they're marching, and then you have them lift their opposite knee like they're marching. Now when they lift their right leg up, so you're gonna basically where you're gonna put your hands right here is you're gonna put one thumb on the PSIS, one thumb on the sacrum, and then essentially you're gonna have them lift their right leg up like they're marching. When they lift their right leg up like they're marching, the sacrum should go upwards, the PSIS should go inferiorly downwards, and then when they lift their left leg, it's gonna do the opposite. It'll go boom, boom. And then you check both sides, have them lift their left leg again, have them lift their right leg again, coming up and down. Now, if there's any kind of error, like you feel like the movement is not moving in that area, then they probably got some SI joint dysfunction. So then you'll go check the anterior in supine and then the posterior in prone and see if there's any like rotations or upslips and rotations or flares or whatever. But what I found the Gillet's test to be most helpful with is finding sacral torsions. So essentially, if this sacrum right here is rotated out, they would call this a posterior sacral torsion. If it's sitting right there on top of that PSIS like this, then essentially when you have them lift their left leg and then their innominate rotates, it's going to push that sacrum out to the side like that, and it's going to kick it out to the side. So every single time you have them lift their left leg, it should go like this, but instead of going like this on this side, it's going to go like that. And you're gonna literally feel that thing kick out to the side like that. And then when we switch positions, instead of going like that, it's going to go like that, sort of a thing. So then essentially you're going to correct it. 90% of the time I run into a left posterior sacral torsion, just like with innominates. 90% of the time I find right anterior rotations of the innominate. So if that thing's posteriorly rotated out through here and you're gonna wanna pull it back in right there, then you're gonna wanna pull the fibers on this direction. So you're gonna use the piriformis that sits right in through there to pull on it, to yank on it anteriorly there with a technique that we have in the course. And then, so you're gonna do one there and then use the paraspinals on the other opposing side to pull it that direction. So you're gonna kind of whittle it back and forth to get it back into place. So that is posterior sacral torsions. Here we'll do another video for the next one.